So at Camarena Health, our school-based health centers provide a variety of services, and they were designed that way to meet the total needs of the students and their families. At both of our health centers, we provide medical, family practice, full dental, behavioral health, health education, enrollment services, and behavioral health navigators. In each of our school-based health centers, we are connected to the school nurse's office. So the school nurse's office is the first entry into our school-based health center from the school side for the students.
I feel like the health centers have been helpful for students' lives. There's a handful of students that I see pretty regularly that come in with conditions that take a lot of lifestyle change to work through. Being on the campus and them working with the health educators and with myself, they've really learned about these conditions and these diagnoses. In a regular clinic, they kind of just learn by proxy through their parents, and they just kind of do what they're told, versus here they're asking whatever questions they need. It's kind of improving their health literacy, focusing on communication. I think that's the biggest thing, making sure we're explaining things at a level that they understand, and also their confidence to be able to explain what their symptoms are.
Very first school-based health center for Camarena Health and for the county of Madera and Madera Unified School District opened its doors in April of 2018. The dialogue around what a school-based health center was really began in about 2015. We had an idea about a model of a school-based health center for a high school campus to really combat some of the needs, absenteeism, seat time, the health and behavioral health needs of the students, and a priority for the school district was making sure that it supported the community and the families of those students. For us, we wanted to look at it as a way, how do we treat that student for all of its needs? So it could be dental, it could be health education, it could be behavioral health, and it could be your medical needs as well. It took a lot of time. It wasn't an easy process. We really wanted to make sure that we did this right. When you think about funding sources for FQHCs in establishing school-based health centers, there's a variety of resources over the years. Some of that funding has come from health plans. HRSA has provided a lot of funding, as well as some statewide funding and grants that have been available for FQHCs. Our first health center was supported by a grant that we received through Anthem Blue Cross. So it helped cover some of the cost of the build for the school-based health center, and it really helps with establishing that model on school sites and getting going for those first years while you are establishing the student base and the patient population.
There's been a few students who have come in with concerns or conditions that were lingering, and they were really affecting their mental health, their physical health. They were very disheartened because they weren't getting better. In working with them and getting them access to behavioral health counselors and myself, and really honing in on what was the actual cause of their symptoms, that truly helped them to improve. You could just see that their overall affect was improving, the way that they carried themselves. I even told one of the students, I feel like you look happier. Seeing them kind of improve overall well-being was very, that felt great.
I have been so proud to see this model grow and just to be a natural piece of the school district and the school site. We're just a natural extension to these campuses. To see the students have successes with their health, those are some of the most gratifying things. We are making a tremendous impact to students and to the faculty and staff and teachers on campus by having these resources there. And we hear so many success stories about what it's meant to have access to care.